Hi everyone, welcome. My name is Brittany Sartain and I'm here with Dr. Vivek Patel, a cardiothoracic surgeon at UT Health Tyler. February is Heart Month, so today we're going to be talking all about heart health. If you have questions throughout the chat, feel free to comment them below and we'll try to get those answered for you. So let's jump in. Dr. Patel, why is it so important to take care of your heart and to know the signs of heart disease?
Well, it doesn't take a heart surgeon to know that the heart is very important. I mean, obviously, everything we do as far as our activity goes, as far as the survival of our body goes, is dependent upon the heart being able to do its job. And so that's why heart disease is so important to treat, because aspects of heart disease affect everything in our body, and really, as importantly, the quality of our life and how we're able to do things.
Okay. So what are the common risk factors for heart disease, and what are some heart healthy habits that people can start doing now to lower their risk?
Sure. So the most common risk factors that we sort of identify with people having heart problems are either lifestyle factors, dietary problems with exercise, and then things that we're born with. So we would associate things like eating unhealthy, that have diets and that are high in cholesterol or high in fats as not being good for your heart. We would associate some lifestyle changes like tobacco use or heavy drinking to not be associated with things that are good with your heart. People who have a more sedentary lifestyle are usually at risk for having more cardiovascular problems. And then people who have a strong family history of heart disease in their parents or first-degree family members can sometimes carry some genes or other defects that would harbor problems with their heart. In addition, diabetes is a pretty significant acquired factor that people can get that can lead to heart problems. And then high blood pressure or issues with controlling blood pressure is also a problem.
Okay. So, I mean, what can people start doing now to lower the risk of getting some of those things?
Well, the first, battle is always to identify these problems before they cause damage to your heart. So the easiest way to do that, of course, is to follow up with your primary care doctor or to go into a wellness clinic and get a checkup to see whether or not one of those modifiable factors exist. So, it's not too hard to get your blood pressure checked, to get things like your blood sugar checked, to do some lifestyle modifications in order to, live a healthier attitude or healthier situation with your heart. There are screening programs that exist for your heart too. So here at UT Health, there is the My Heart First Clinic. So if you feel that you have risk factors in your family and you're concerned about heart disease, there's a fairly easy screening program that can be done where they can look at certain risk factors. They can do some scans of your heart fairly reasonably to see if you're at risk for some of those problems.
Okay. So what are the most common types of heart disease and what are the symptoms for those?
Sure. So in the adult population that we deal with, typically we divide the most common heart problems into two sections. One would be what we call ischemic heart disease. And ischemic heart disease means that not enough blood is getting to the heart muscle. That's typically associated with blockages in arteries and those aforementioned risk factors that I was talking about, things like diabetes, tobacco use, high blood pressure, cholesterol. Mm-hmm. And what happens when the heart muscle doesn't get enough blood is you have a heart attack and part of the heart muscle gets damaged. Mm-hmm. The second kind of common heart disease that we see is what we call structural heart disease. Mm-hmm. And that is where a part of the heart or heart valve doesn't work because it's not functioning, it's not opening or closing like it's supposed to, and so it restricts the blood flow that travels through the heart. Now that sometimes is a much more difficult problem to diagnose because many of these patients won't really have any of those risk factors that we talked about. And sometimes the symptoms can sort of slowly creep up on somebody. Okay. So they may not really recognize that something is changing as fast as, let's say, if you had pain with a heart attack.
Right. Okay. So as a cardiothoracic surgeon, you see a lot of patients who have heart valve disease. Mm-hmm. Can you tell us a little more about that, kind of what it is and the symptoms of that?
Of course, yeah. So the heart valves are structures in the heart that regulate which way the blood flows. Obviously, you want the blood to flow in one direction, so that's a very efficient mechanism of how the blood gets around your body. So the heart valve's job is to prevent blood from going back into the chamber of the heart where the blood had come from. And so when these valves don't function by either not closing properly or not opening enough, it either makes the heart do too much work to have to pump the blood flow through it, or in situations where it's lasted a long time, it can damage the heart muscle and not allow it to function properly. Typically, these patients will present with sort of inability to do a lot of the activities that they would previously be able to do. They may find it more difficult to walk, more difficult to breathe, more difficult to sleep. They may notice some swelling in their body or their legs. And sometimes it can present with abnormal heart rhythms where they feel their heart racing fast, or they just don't feel like they have the same energy or stamina that they used to in the past.
Okay. So how is heart valve disease usually treated, and how do you decide which treatment option is best for each patient?
Well, I think the first thing is you have to diagnose it, right? So you have to be able to figure out exactly what the problem is, because unfortunately a lot of these diseases overlap. Sometimes heart disease can be associated with lung disease or malnutrition or other problems in these patients. So really it's important to get with a very experienced center that has a good sort of grasp on how to figure these things out. Typically a cardiologist will be very instrumental in sort of the decision-making process, where they'll do things like echocardiograms and heart catheterizations to determine how bad or severe the damage is or the heart valve functioning it is. And then it takes sort of a team of people to get together to determine sort of what the best way to treat these problems is. Because fortunately, in the last 5 or 10 years, many different types of treatment for these problems have been developed. And so we try and tailor these treatments based upon, somebody's health, someone's other health problems, their life expectancy, and their ability to recover from procedures as well.
Okay. So I know there's a few different treatment options. Can you kind of go over some of those, from surgery to different procedures?
So the standard of care for most heart conditions obviously is still medication and modification of our lifestyle. So there is no heart condition that we primarily treat without trying to usually put someone on some degree of medication to both reduce the strain on their heart and allow the blood to flow a little better. And then the standard of care for ages has always been, if someone can have surgery in order to fix these, to go ahead and to open the heart and to repair these heart valves. And sometimes the valves can be fixed and sometimes they have to be replaced. And so we have different options available for replacing these valves. In the last 5 to 10 years, different therapeutic options have sort of come about where we're able to use what we call transcatheter techniques. That is, we go up through the patient's own blood vessels toward the heart and are able to either repair or replace these failing heart valves in order to get them to work properly.
Okay. So then what about the MitraClip procedure? Can you kind of tell us about that?
Sure. So the MitraClip procedure is a relatively new procedure that we've been doing here. We're the first hospital in Tyler to be able to offer that to our patients. And what it involves going through a small blood vessel in the leg and going up to their heart and actually applying a small clip to the tips of the valve leaflets. So really the problem in mitral regurgitation where the blood is leaking is the two doors of the mitral valve are not coming together. And so because they're not closing, the blood leaks out through the valve. So what this clip does is it brings the two doors or the two leaflets of the valve back together again to allow them to meet, and so the blood doesn't leak back through that heart valve.
Okay. So what would be the benefit of the MitraClip?
Well, the benefit is it takes care of a lot of those symptoms that people have. So people that haven't been able to be very active, they haven't been able to leave their house, they haven't been able to go to church or to the grocery store, or toward their kids, you know, games or their grandchildren's activities, it allows them to return back to some normal semblance of having their life. And in a way that it's not a very long and painful and lengthy recovery from surgery, which, you know, as a surgeon, obviously we know can be very difficult on some patients. So that has been the benefit. It's allowed us to treat a new group of patients that we didn't have any treatment for beforehand.
Okay. So what is the recovery process like for these procedures?
So phenomenal. Typically the procedure is done in the hospital. It takes us about approximately 3 hours or so to do the procedure. And then about half of our patients have gone home the first day after the procedure, and about the other half usually go home between 2 or 3 days after the procedure. And then the restrictions on limitation after the procedure are usually only for about the first 3 days or so. And after that, people are allowed to drive, they're allowed to leave their home, they're allowed to walk. So it's pretty revolutionary.
Awesome. Are these surgeries and procedures, are they a cure for heart disease, or is there a chance that if someone goes through this, they can have the same or other heart conditions show up again later?
So very good question. Unfortunately, there's really little in modern medicine that is truly a cure for any of these problems. And by that I mean we can take care of some of these structural heart problems or ischemic problems, but the actual problem that caused that in the first place needs to be addressed as well. So certainly any patient that has a procedure done to fix a heart valve or to cure a blockage needs to continue up to follow with their primary care doctor and their cardiologist. They need to stay on the medications that are prescribed, and they need to have regular follow-ups, and usually things like echocardiograms or stress tests to make sure that their heart is still functioning properly. Once again, you know, the main factor in heart disease is if you catch it early, there's a much better chance of fixing it, right?
Right. So at what point should someone seek treatment if they think they might be feeling symptoms of heart disease?
So very difficult question to answer. And I would say if you feel like something is out of the ordinary, at least bring it up with your primary care doctor. You know, that's really the most important and first line of defense that we have in catching a lot of these problems. So, you know, the symptoms to watch out for are things like I said, shortness of breath or fatigue. You're getting tired out or worn out very frequently. You notice that you can't catch your breath after activities that you used to be able to do. You're noticing a lot of weight gain or swelling in your body. You're noticing that your heart rate or rhythm is abnormal or abnormally fast. You're noticing that, you know, just things haven't been working properly, I guess, with your heart. I mean, it's a tough thing to describe because we're all different, and heart disease manifests in so many different ways for different people. But with that said, there's very simple tests that can be done in the beginning to figure out if something is wrong or not. You know, things like echocardiograms or EKGs are non-invasive. They don't require a whole lot of money or pain or anything to undergo. So it's an easy thing to sort of rule out quickly as well.
Okay. We had one question come in, and she asked, what are some of the best workouts I can do for my heart?
So certainly, you know, we consider to be exercises that will get your heart rate up to a reasonable level in order to allow the heart muscle to strengthen, allow enough blood flow to go to the heart muscle. And, you know, it's tough to say because workouts are only as good as your motivation to do them. So if running is what is something that keeps you involved in your exercise, if you know, rowing, or if just brisk walking, or if jogging, or if biking, any activity that you can sort of do consistently to allow your heart rate to get to those levels that require it to work on your heart is fine. I mean, you know, personally, I think for me, varying activities over a period of time is better because it allows me to stay interested in it. Does that hopefully answer some of that?
I think so. All right. Well, those are all the questions we have. Dr. Patel, thank you for taking the time
My
to talk
pleasure,
to
my
us today.
pleasure. Yeah.
Thank you, everyone, for joining. If you have further questions, you can comment them below. We'll try to get those answered for you. You can learn more about the effects of heart disease on our Heart Month page. You can go to uthealtheasttexas.com/Heart Month. Thank you.